there is a world 5 years from now where some patients will need to see the dentist once every 3 months, and some patients will need to see the dentist once a year. It really depends on what your personal condition is. And then going from there, the different care recommendations that you would get are much more personalized to whatever the condition is. The other thing, and the flip side of it, is that the care would actually be much more transparent and standardized. So there's this, for those of us in the oral health and dental industry, there's so many misconceptions about by patients, justifiably and unjustifiably, that they're trying to oversell, or they're trying to get more money from me when I go to the dentist, and so forth. So now, with automation and personalization, the next step is going to be standardization of what, if you go to one dentist versus the other, how much something would cost, and why is that the recommendation for you. And then the last thing I would say is probably the holy grail of part of our conversation today, which is full integration with the medical system. We always talk about someone taking a very interesting, and for some of us, we're not sure whether it was a smart decision to bifurcate the two systems 100 years ago. So you have your medical insurance and then you have your dental insurance. A lot of us believe that those should be merged back together to be part of the full system, because there's so much connection between your oral health and your full body health, as we discussed. But in terms of GRIN's role, we hope to lead that transformation. We really do have the tools to help do that on many levels, both in terms of the hardware and in terms of the software and the algorithms, but also kind of the cultural attention to what is needed in order to go through that paradigm shift. And we really hope that that GRIN would be that smart catalyst.
hmm No, that's amazing. What I really love about, health tech right now, there's so many people innovating and trying to do really, really good work. And what advice would you give to founders of health tech or health tech innovators looking to build more equitable products?
Yeah, I would say start by listening. So I know, again, this might sound a little bit cliche, but equity can't be bolted